Welcome to the AACC Critical and Point of Care Testing Division Certificate Program for Point of Care Specialists. This is the Regulations course, and during this course, we will review regulations, accreditation, standards, and guidelines, looking at the differences between these topics and what you can do to prepare your system to meet all applicable requirements. Regulations are laws. These are set nationally, at the state or provincial level, and by local jurisdictions. They cover all aspects of laboratory testing, including, but not limited to, the personnel requirements for testing, quality assurance programs, proficiency programs, testing requirements, documentation, external audits, and other topics. Accreditation is the manner in which a laboratory shows that they are compliant with all applicable regulations. In the United States, there are three major not-for-profit accrediting agencies. These are the College of American Pathologists, the Joint Commission, and COLA. However, it is important to note that these agencies also accredit internationally. Laboratories outside the U.S. may seek certification to the International Organization for Standardization, or ISO, through Standard 15189, which applies to medical laboratories, and Standard 22870, which applies to point-of-care testing, and is used in conjunction with Standard 15189 in hospitals, clinics, and healthcare organizations. The ISO itself does not perform the certification. It is performed largely by private companies. A standard is a document that identifies specific essential requirements for materials, methods, or practices to be used. The standards are produced by a wide variety of organizations using a consensus process in which members of various disciplines, for example regulators, manufacturers, and laboratorians, will come together to develop a standard which they feel represent best practice. Organizations that develop standards include ISO, which is the International Organization for Standardization, CLSI, the Clinical Laboratory Standards Institute, and IFCC, the International Federation of Clinical Chemistry. Guidelines, like standards, are developed by a consensus process. In general, neither guidelines nor standards are required by regulations. However, following both guidelines and standards will assist in your compliance programs. There are two types of guidelines: general guidelines on procedures and processes, and evidence-based medicine guidelines that are specific to disease states or diagnoses. Again, there are a wide variety of organizations that are involved in guideline development, and these include, among others, the National Academy of Clinical Biochemistry, the International Federation of Clinical Chemistry, the American Heart Association, and the National Kidney Disease Education Program. In the United States, the National Regulation of Clinical Laboratory Testing began in 1967, when the United States Congress passed the Clinical Laboratory Improvement Act. At that time, the CLIA regulations covered only clinical laboratories that were engaged in interstate commerce. These regulations were expanded to include all laboratories, including physicians' offices, with the Clinical Laboratory Improvement Amendments of 1988. CLIA defines three levels of testing. They are waived, moderately complex, and highly complex. Waived tests may have been cleared by the U.S. FDA for home use. They are defined as tests that employ methodologies that are so simple and accurate that the likelihood of getting an erroneous result is negligible, or that they pose no reasonable risk or harm to the patient if the test was performed incorrectly. A comprehensive list of waived tests can be found on the Centers for Medicaid and Medicare Services website. The package inserts of most tests will also include their CLIA categorization. Moderately and highly complex tests are defined by the U.S. FDA using a complexity scoring based on 7 criteria. Each criterion is based on a scale of 1 to 3, 1 being very simple and 3 being the least simple. These 7 criteria scores are added, and scores of 12 or lower are considered moderately complex. Scores of 12 or higher are considered highly complex. Most non-wave point-of-care tests are considered moderately complex. The 7 criteria used to determine whether a test is moderate or highly complex include the knowledge base and training required prior to beginning to use a test process, the complexity of a reagent or material or sample preparation, the actual operational steps involved in running the test, requirements for calibration, quality control, and proficiency testing, test system troubleshooting and maintenance, and very importantly, the level of interpretation or judgment that is required prior to taking the result of that test and using it in clinical practice. No matter what type of testing is being performed, every laboratory in the U.S. must have a CLIA certification. There are 4 levels of CLIA certification: a certificate of waiver for laboratories performing only wave tests, a certificate of provider-performed microscopy procedures, which allows physicians, mid-level practitioners, or dentists to perform a microscopic exam. Sites with a PPM certificate can also perform wave testing. A certificate of registration, which is then followed up with a certificate of compliance after inspection of a laboratory by CMS. This inspection certifies that the laboratory is following all CLIA regulations and may perform moderately complex testing. A certificate of accreditation allows the testing of waived, moderate, and highly complex assays, and these are issued by private accrediting agencies. The 3 most commonly used agencies in the U.S. are the Joint Commission, the College of American Pathologists, and COLA. TJC accredits approximately 2,000 different organizations, which include about 3,000 CLIA and internationally certified labs. Surveys are conducted using a comprehensive accreditation manual for laboratory and point-of-care testing, or the CAM lab. These surveys concentrate on the effect of laboratory policies on safety and quality of patient care. They are not so much concerned with the specifics as with the results of those policies and procedures. Joint Commission surveyors are employed by the Joint Commission, are given scoring guidelines to use during their surveys, and all have relevant clinical experience as well as laboratory management experience. The College of American Pathologists accredits more than 6,000 laboratories worldwide. CAP has a checklist-based accreditation program, and there are checklists for a wide variety of different specialties, with a separate checklist specific to point-of-care testing in addition to the general laboratory accreditation checklist. CAP surveys are conducted by peers. These are current laboratory professionals who are trained to perform CAP inspections. CAP defines point-of-care testing somewhat differently than as defined by other agencies. The CAP definition is that these are tests that are used at or near the site where the patient is located. It excludes any testing performed within a clinical laboratory, including limited service satellite laboratories, multi-channeled blood cell counters, or patient self-testing. COLA inspects more than 33,000 organizations. Initially, it was an organization focused on accrediting physician office laboratories. They have since expanded their scope and include larger laboratories as well. They are deemed or approved by CMS for the inspection of a wide variety of different clinical specialties. COLA also offers educational courses online, and surveyors for COLA use clear regulations and COLA-specific guidelines that adhere strictly to those clear regulations and do not add any additional requirements. The primary consideration in choosing an accrediting agency will depend on the country where the lab exists and any laws that govern laboratory testing and POCT in that location. After that, a critical consideration is the type of testing that is being performed. Cost should also not be overlooked. A laboratory should consider an agency that best fits its operation and regulatory needs. In the U.S., if a laboratory is performing only waived or provider-performed microscopy testing, it is common for inspection to be performed by the CMS or state agencies without additional accreditation through one of the private accrediting agencies. The choice of a certificate of compliance immediately requires on-site inspection by CMS. If a laboratory is seeking a certificate of accreditation, then the laboratory must name an agency to accredit their testing, whether that be the Joint Commission, the College of American Pathologists, or COLA. In addition, CAP is very strict in their regulation of proficiency testing materials that can be used. They also add additional requirements beyond those of CLIA regulations to their accreditation standards. Additional requirements are also added by the Joint Commission for their accreditation standards. COLA accreditation is strictly by CLIA regulation. The COLA fees are typically lower than CAP or the Joint Commission. Many sites will decide to use a combination of agencies. For example, the Joint Commission for wave testing, because nurses who are performing much of the testing may be more familiar with the concept of inspections by the Joint Commission, and CAP for non-wave testing, where many users are laboratorians or others who are more familiar with the College of American Pathologists. Accrediting agencies require the accredited laboratory to participate in an approved proficiency testing program or external quality assessment survey. Certifying to ISO standards also requires this. In the U.S., CLIA regulations require that proficiency testing be performed for all laboratory tests, excluding wave testing and some provider-performed microscopy. State regulations will often add requirements for proficiency testing in some of the wave tests that are available on the market. Proficiency testing results are monitored by the accrediting body, whichever is chosen by the laboratory. If you are unsuccessful in a proficiency testing challenge, you must submit a plan of corrective action to your accrediting agency. If this is not done, or if the accrediting agency finds the plan unacceptable, or if the site fails to achieve a successful proficiency testing result on the next 2 consecutive testing events, the site must cease patient testing for that specific analyte. The most important factor in successfully passing through an inspection is preparation. The more prepared a site is, the more fluid the inspection process, and the more likely that major deviations will not be seen. Important points to keep in mind include having all records well organized so that they are easily accessible and can be easily retrieved if the inspector asks a question. If you have a complete knowledge of the accrediting agency's standards, you can complete a self-inspection, actually walk through your program as though you were the inspector, and identify any deficiencies or opportunities for improvements prior to a formal accreditation survey. There should also be a process for continual improvement in your program. When preparing for an accreditation inspection, make sure to inform all individuals who may come in contact with the inspector that it is unwise to volunteer any more information than is specifically requested. Make sure all of your procedure manuals and training documentation are up to date and available. Make sure that documentation for all laboratory testing being performed is being retained for the proper amount of time in compliance with your local document retention policies. There should be validation data available for all instruments and methods in use, no matter how long they have been in use. It is likely you will be asked to show examples of point-of-care test results as they are recorded in the patient's chart, whether an electronic medical record or a paper file is used. Be sure that you have your performance improvement programs documented with results clearly stated, or at least a plan as to how those results will be measured. One of the primary compliance issues raised during an inspection is that of reagent dating. For reagents that are stored in a refrigerator for long-term and then moved to room temperature for short-term, the expiration dating generally must be changed. These changes have to be clearly indicated on the test packaging. Also be certain that standard safety precautions are being followed across all sites. In summary, compliance is a multifaceted program that must adhere to regulations and accrediting body requirements, and can be assisted by the use of standards and guidelines.